That's good. It's going to capture this. I don't know. Might not. Yeah.
I sent it to you. I converted to docs.
PDF?
Yeah, and converted to Word.
Word?
Yeah.
No, I need PDF.
You want a PDF?
Yeah. No, I want it PowerPoint, sorry. See, I know I never think. When people come in and talk to me, it's nothing. I'm saying, yeah. It's crazy. Yeah. So whatever is being displayed, you will see that, right?
Yeah. Sure. Let me double check.
Working?
Yeah.
Okay. We did 2? 3?
That's one word.
Okay. A 2-year-old boy suffering from lethargy, seizures, and vomiting is diagnosed with deficiency of a urea cycle enzyme. Again, number 1, N-alkaptonuria is homogenesic acid oxidase enzyme deficient, which is not an urea cycle enzyme anyways. So that's clear cut. Whoa. So why does... Okay, where is the... pen? There you go. So this is not a urea cycle enzyme. Ketoacidosis, ketone bodies are produced. It's not produced in the urea cycle. Okay, just to keep it simple. Phenylketonuria, again, that is cytoplasmic enzyme. Phenylketones, not part of the urea cycle. Amino acid cycle, and cystinuria, none of them are urea cycle. This is the only one. And the issue with the urea cycle is that means carbamoyl phosphate, when it accumulates within mitochondria, because there's urea cycle enzyme deficiency, carbamoyl phosphate will leak out. Look, you can consume it, convert to urea, right? There's 2 ways. You convert it to urea, or it spills out of the mitochondria. So carbamoyl phosphate in the mitochondria has 2 pathways. If it's consumed, converted to carbamoyl phosphate, and then to urea, done. That's the preferred pathway. But if it accumulates, then it's going to spill out of the mitochondria and come to cytoplasm. In the cytoplasm, carbamoyl phosphate is combined with aspartate to make ornithine. Orotic acid. Orotic acid. Okay, so that's where the thing is coming from. Okay. Number 4. A 40-year-old female joins a local gym to lose weight. Her trainer puts her on vitamins and amino acid supplements. Few days later, she develops tachycardia, sweating, and diarrhea. Look, tachycardia means increased heart rate. Correct?
Yeah.
Okay, so that's increased heart rate, sweating, and diarrhea. So this is usually related to thyroid hormone. Okay, so whatever is the source of thyroid hormone. Alanine is for glucose generation. Okay, tyrosine is for norepinephrine and epinephrine, right? Both of them will cause tachycardia, sweating, and diarrhea, regardless, right? And lysine is used for what? Lysine. Only for DNA synthesis, in the case of compacting of DNA. Proline is for? What is proline used for? Collagen synthesis. Phenylalanine is the same thing as tyrosine. So it's the tyrosine that's directly used for thyroid hormone synthesis. So this question is talking about thyroid hormone. Let's see. Okay. The previous one?
I was confused between tyrosine or phenylalanine. But I chose phenylalanine because that would be the essential amino acid. Tyrosine is
You're right, tyrosine is not, but tyrosine depends on phenylalanine. See, the question is, you can get tyrosine from your diet too. So they're asking you the supplement of which of the following. See, phenylalanine can become other stuff too, but tyrosine can most likely become what? Thyroid hormone. It's more specific. Yeah. A 33-year-old male visits your office complaining of periodic palpitation. Palpitation is increased heart rate that you can feel and hear. Blood pressure is 150 over 90, that's high. Pulse is 120, that's high. Abdominal CT scan shows a left suprarenal mass. What are you going to think? Adrenal medulla problem. So it's either pheochromocytoma or neuroblastoma. Looking at the age, pheochromocytoma. Increased activity. Which of the following enzyme is most likely responsible for these effects? E talks about phenol, ethanol, amine, and methyl transfers. That's correct. Yeah. Okay.
Why can't it be F?
Let me go over each. Phenylalanine hydroxylase. Phenylalanine hydroxylase is not going to contribute. Phenylalanine hydroxylase is not needed for, in the sense, right? Exactly. So there, if you remember that I told you epinephrine and norepinephrine, that's W, not N. Norepinephrine is produced by the adrenal medulla, correct? What percentage is epinephrine? 90%. Only 10% is what? Norepinephrine. So the major product of adrenal medulla or pheochromocytoma is what? Epinephrine. So obviously you're going to look for that. So the activity of conversion of norepinephrine to epinephrine is much higher. And therefore the enzyme that is converting norepinephrine to this should be higher. Not necessarily production of norepinephrine. See, norepinephrine is produced in all other cells. But there's only increased activity in the adrenal medulla, not in other cells. So the enzyme that's relating to that is this one, F. Catechol or methyl transferase. Yes, this activity is also increased. It's true. But that's the breakdown product. Okay. So this is more increased, and this will respond to. So F is also partially correct.
No, because it's asking for what causes it.
Does it increase activity which of the following enzyme is most likely responsible for the effects observed? Yes. Which is palpitation. It's not, that means increased epinephrine. Yeah.
Can be F, right?
Yeah. Cannot be F. Okay. Are we good? A 62-year-old male Caucasian alcoholic male passed out on the street is brought to the emergency room by paramedics. The man is dehydrated. His skin is rough and dry. He can't remember his name. He's diagnosed with vitamin deficiency. Which of the following amino acids precursor to the vitamins deficient in this patient?
Tryptophan. He's got niacin deficiency.
Why do you think it's niacin deficiency?
Allegra. He has the skin dermatitis.
Mm-hmm.
He's passed out, so it's basically.
And he cannot remember his name?
Dementia.
Dementia. Okay. Yeah.
Isn't that work making prescribed?
No, not B1, because alcoholism is leading you towards that. If Wernicke-Korsakoff, you have B1 deficiency. True, it's alcoholic, it's very common, but you would not have dry skin. Okay, it's not so much dementia in those cases; it is more psychotic behavior, mood changes. So Wernicke-Korsakoff, you can have cranial nerve neuropathies. Okay, which means you cannot move your eyes properly. They may be twitching a lot. You can have nystagmus, you can have strabismus. Okay, that's with B1 deficiency or mental problem in terms of mood changes, psychotic behavior, depression and aggression and things like that, and heart problems, congestive heart failure. That's B1. But here it's clearly telling you dementia, cannot remember his name, and dry skin. Dermatitis, dementia, diarrhea, and dementia. So that 3 is always pellagra, and the tryptophan is correct. A group of researchers are studying the role of thyroid stimulating hormone receptor in the development of thyroid cancer. So they just want to know what is the role of TSH receptor in thyroid cancer. TSH receptor has 3 domains: cytoplasmic domain, transmembrane domain, and extracellular domain. Special attention is paid to the transmembrane region of this protein that contains several alpha helical regions, each composed of approximately 20 amino acids. The transmembrane domain is most likely made of what? See, it's a long question, but who cares? They're asking you the transmembrane part of this protein or receptor is made of what? It should be lipid-soluble amino acids. The transmembrane domain should be lipid-soluble hydrophobic amino acids. We discussed this many times. So you look for them. You should have memorized them. Don't pour water on TV and film. Okay? So which of these are, for example, yeah, very good, C. That's hydrophobic.
Also, most of the other answers aren't even like amino acids. Right?
No, they are all amino acids.
Serotonin and niacin.
Citrulline is amino acid. Where's serotonin?
D.
Yeah.
Niacin.
No, that's completely out, yeah. Good. A 9-year-old male is evaluated for a periodic pruritic skin rash and diarrhea. Again, rash and diarrhea, so dry skin. You can think of pellagra-like symptoms. The symptoms develop whenever he goes to the beach. Laboratory evaluation reveals loss of neutral amino acid in urine. This patient's symptoms could most likely have responded. This is actually Hartnupp's disease.
Still nice.
Niacin. Very good. Okay, Hartnup disease, niacin. So this is because of tryptophan problems. The amino acid is tryptophan. Okay. Number 9. An 8-year-old infant is brought to your office because of developmental delay. Blood test reveals megaloblastic anemia and high plasma homocysteine levels. So most likely megaloblastic anemia, so that means B12 problems. If it is homocysteinuria, right? Symptoms of which of the following substance is most likely impaired in this patient? Methionine, yeah. Methionine. If it was cysteine problems, then they won't have megaloblastic anemia. Okay? Let me see if I can go to, you know what, I can keep it simple and easy. Where is... what they're asking you, it's okay. They're asking you, next time I should just use this. They're asking you, for example, you know, you have methionine is, let's say here is methionine, and here is homocysteine, and here is cysteine, right? Okay, so homocysteine can be converted to this, and homocysteine can be converted to this. This requires B12 and this requires B6. Only B12 is involved in megaloblastic anemia. B6 is not. So that's why it's not cysteine problems. It is B12 problems because the person has megaloblastic anemia. The person has megaloblastic anemia. Does it make sense? Okay. Okay. This is the one we did? So 10. A 44-year-old homeless male comes to the emergency room because of recurrent nosebleeds. Physical examination also reveals perifollicular petechiae. See, perifollicular means around the hair follicles. Petechiae means bleeding. Tiny bleeding, small bleeding. The smallest bleeding are known as petechiae. Okay? And hemorrhagic gingivitis. Bleeding gums. Inflammatory gums are bleeding. Now whenever you hear those, think of always vitamin C. Always think of vitamin C, period. Okay. Abnormality in which of the following process most likely the cause of this person's condition? Proline hydroxylation is true, and that is for vitamin C deficiency. See, vitamin C is required for hydroxylation of proline and lysine residues on collagen. And collagen is required for strengthening of blood vessels and gums, so they will bleed if they're weak. Okay? A 12-year-old male dies of a stroke. If a young patient dies of a stroke and we're thinking of vitamin problems, you're going to think of B6 or B12. It's homocysteine for sure. There's nothing else. Because homocysteine leads to what? thrombotic events. So anyhow, I haven't read it yet. Let's finish it. Past medical history is significant for dislocated lens, seizures, and mental retardation. Autopsy reveals complete occlusion of internal carotid artery by massive thrombus. Which of the following vitamin supplementation could have prevented this? D, B6. Okay. A newborn experiences poor feeding, vomiting, and hypotonia 3 days after birth. So feeding problems because maybe the esophagus is not swallowing properly. Hypotonia, muscle tone is low. Whenever you think of hypotonia and difficulty feeding, think of muscular problem, maybe lack of ATP, muscle does not contract properly. Okay. Plasma test reveals ketoacidosis and hypoglycemia. Now, if it's hypoglycemia and ketoacidosis, you maybe think of glycogen problems. His urine smells like burnt sugars. Metabolism. Now, burnt sugars, when you use that term, think of maple syrup urine disease. So this person will be normal if he is not hungry, only when this child is actually not being fed properly, and then they will have problem. Otherwise, it's not a big deal. Okay. So now you know that for maple syrup urine disease, it is valine, isoleucine, and leucine accumulation. You cannot break them down. So there's H. I'll use that. Good. A 3-year-old female experiences periodic lethargy, vomiting, and confusion. Blood test reveals increased plasma ammonium. Urine analysis shows markedly increased urine uric acid excretion. Which of the following enzyme is most likely deficient in this patient? Deaminase, arginase, cystathionase, transaminase, asparaginase, glutaminase, tyrosinase.
It's arginase.
Very good. Very good. It's a urea cycle problem. Urea cycle problem. Okay. None of these enzymes are related to urea cycle. This is the only one. Deaminase is a general term. So no, not in the urea cycle. Outside of the urea cycle, yes. Yeah. Okay. So deaminase 1 can be deficient, 2, 3, but there's a lot of them. Okay. But arginase specifically will build up urea. Okay. Deaminase, you cannot deaminate a specific amino acid. So a newborn infant develops vomiting, lethargy, and seizures several days after birth. Liver biopsy confirms defective transport of ornithine. Ornithine is used for what? Urea cycle. Good. Okay. Which of the following substances in the diet should be, avoided to improve this patient's condition? Proteins. Very good. Okay, proteins. Although purines, I mean, you can say that specifically, but they also can do that. But proteins more specific, yeah.
What diet is rich with purines?
What diet?
Yeah.
Purines or protein?
Purines.
Purines. Red meat, red wine, grapes, things like that.
It's protein.
Purines, no. Purines is not protein. It's nucleotides.
No, I mean red meat.
Yeah, it has protein as well. Look, again, let me tell you guys that don't ever think when we say tuna is rich in protein, it doesn't mean it has no lipid. It does have lipids. It's rich. It's not 100% protein. So when I say red meat, it doesn't mean it's only protein. It has a lot of lipids. But it also has nucleic DNA. Every cell should have DNA, correct? Isn't meat made of cells? Okay. So as you chew them, you burst them, and they will release those DNA in your mouth, and you digest them in your.
Yeah, good.
Yeah, still has DNA. Still has DNA. It'll be denatured, but the nucleotides are still there. Okay. Okay, what does it say? 28-year-old female brings her newborn son to your office because of seizures. Blood test reveals increased ammonium level. Liver test shows reduced N-acetylglutamate formation. Which of the following reactions is most likely impaired? A. The only reaction that depends on N-acetylglutamate is A.
Yes, one.
Yeah. A 11-year-old Caucasian male is brought to the emergency room because of severe chest pain. Too young to have chest pain, right? Blood test reveals an increased serum methionine level. Oh my god. Now, if it's increased methionine level, what does it mean?
It will attach the
That means the problem is in homocysteine. You cannot convert homocysteine to what? Cysteine. So this is homocystinuria. Coronary angiography shows left anterior descending artery stenosis. Which of the following amino acids is most likely essential in this patient? Cysteine, because you can't make it. You must get it from your diet. Okay. Okay. 18-year-old male complains of bilateral knee joint stiffness. On physical examination, you notice dark spots on his sclera and ears. That means what? Alkaptonuria so far. Abnormal deposition of which of the following substance most likely responsible for this patient's condition? Homogentisic acid. Very good. An infant is brought to your office by his mother because of failure to thrive. His stool are foul-smelling, bulky, floating, and pale. That means he has lipid problems. Blood test shows reduced level of vitamin A, D, and K. Again, lipid problem. Duodenal biopsy reveals diminished brush border and enterokinase activity. The formation of which the following substance is most likely impaired. We haven't talked about this. Huh? Trypsin? Yeah. Cyclooxygen is antioxidant and
Trypsin.
formation of which the following substance is most likely.
Can be like this. Trypsinogen is created by it, right?
Now, what are we talking about in this case? See, you don't have enough knowledge, but give me your best shot.
Branch enzyme.
No.
Branch for
An infant, he's brought to you because he's failing to grow. Why? Good. So he cannot absorb what? Milk. But it's telling you that this person is unable to absorb vitamin A, D, and K. These are these are fat-soluble vitamins. You probably don't know yet. So for fat-soluble vitamin absorption, you need lipids and bile acids. Further, it tells you his stool are foul-smelling, bulky, floating, and pale. This is steatorrhea. Fatty diarrhea. So this person is not able to break down lipids and absorb lipids. Now, everything in this case, but you don't know that. So what is your diagnosis when a child, so the person has pancreatic insufficiency, cystic fibrosis. This is a case of cystic fibrosis. And cystic fibrosis, you know, the pancreatic ducts are blocked. What time is it? Oh, we have time. So the pancreatic duct is blocked. If the pancreatic duct is blocked, that means what happens to pancreatic enzymes? They're not secreted into the duodenum. We'll discuss this Monday, because Monday we're going to start with what? GI. We'll start with embryo, then we'll go to anatomy, then we'll go to physiology. Okay?
Don't you also build up and dissolve the pancreas itself?
Yeah. That is an acute pancreatitis, not chronic. Yeah. So this is why trypsin is the most important one. Okay? Which activates all other enzymes. But we don't know that yet, so just leave it for now. This is a difficult question for you for now. Okay? A 5-year-old immigrant from Eastern Europe is being evaluated for attention deficit and hyperactivity disorder. The patient has blue eyes and fair skin and mousy body odor. Which of the following amino acid is most likely essential?
Yeah, I think mousy body odor.
Huh?
Mousy? What's the mouse word?
Yeah.
Body odor.
PKU.
Mousy. If you live by rats and mouse, let's ask, what's the Batman's friend?
Robin.
No, the enemy. The penguin guy.
Enemy.
Yeah. He has a lot of rats and stuff, so we can ask him, but it's sort of like a, I don't know how to explain it. It's just not a pleasant smell.
Maybe urine smell.
No, it's not urine smell. The smell is almost like, you know, when you sweat and you don't take shower, and then on top of it, you're just sitting in one place for a long time, that's the kind of smell, mousy smell.
It has like mousy instead of musty.
No, it's mousy is okay too. Both could be used. Both are okay. Both are okay. Yeah. Musty is okay, so is mousy. They're both okay. And then that's phenyl acetone that gives you that kind of odor. Yeah. So yeah, tyrosine will be essential. Yeah, because you cannot make tyrosine. This is PKU. Okay, so challenges, can you diagnose this as PKU? Yeah. If this is PKU, what becomes essential is your body cannot make tyrosine, so it becomes essential for you to get it from your diet. Okay. A 22-year-old female with gastronoma. Again, you guys don't know about GI. Gastronoma is a tumor of the GI that produces gastrin. Has been suffering from duodenal ulcer, diarrhea, and protein malabsorption. Again, if you have gastronoma, there will be too much acid coming to the duodenum and then denaturing pancreatic enzymes. So that's what they're talking about. As I said, it wouldn't really denature. Which of the following enzyme is most likely responsible for this person's protein malabsorption? It has to be trypsin. Trypsin. See, trypsin is required for activation of all pancreatic enzyme. Again, we haven't gone to GI. So these are GI questions, not necessarily pure amino acid metabolism. So we'll get there next week. It was too early, I think. So that's good. It was for practice, right? You were not graded on this when you guys did it yesterday. Huh? Yeah, which is good. So, for all pancreatic enzymes, see, all pancreatic enzymes are released in the zymogen form. They're inactive. You don't want pancreatic enzyme to be active because it will start eating the pancreas itself. You want them to be active temporarily, only for the period of time so you can digest food and then they deactivate it later on. So pancreatic enzyme becomes active in the duodenum only. Normally, not pathologically. Normally pancreatic enzyme should become active in the duodenum. And the enzyme that activates all of them is trypsin. But trypsin itself is activated by enterokinase or peptidase B, which is duodenal brush border enzyme. So trypsin has to come in contact with enterokinase. When it becomes active, then it will activate everything else, itself as well. Okay, so why trypsin is the most important one amongst the pancreatic enzymes. So that's what they're asking about. But as I said, don't worry about that. You will see this one, maybe you should know. In experimental study of gluconeogenesis, the conversion of alanine to glucose is monitored by labeling the nitrogen atom of alanine radioactively. Which of the following molecules would most likely be detected in urine as a carrier of radioactive labeled nitrogen? Yeah? Yeah? Urea, not uric acid. See, alanine is deaminated, right? Its ammonia is removed, and its carbon is used for sugar. So the ammonia is carried where? In urea. Yeah. But now, what if I do this? Let's see. Let me go back to this question. Which of the following molecule would most likely be detected in be found in urine? That's what they're saying, in urine. Carrying the radioactive label nitrogen. Urea is correct. If I ask the same question and I change it, which of the following molecule will be identified in blood as a carrier of radioactive label nitrogen? Glutamine. Good job. Okay. So in blood it is glutamine and alanine itself carrying the ammonia group. But when it comes to urea cycle, then it's carried by urea and urine. Wow, why do we... I thought we were on a 20.
Just the last two.
Sure.
Yeah,
Okay. This question, just when I finish, tell me, I can draw it on that thing. It will make more sense. A 28-year-old Polish female brings her 33-year-old... This is all East Europeans. What's going on? Everybody is East European in these questions. Her 3-year-old son to your office because of seizures. On physical examination, you notice a measles-like rash and some bruises. The boy immunization history is unknown. Which of the following could benefit this patient? Vitamin A is known to help measles patient. That's about it. Because it acts as an antioxidant or antiviral. That's about it. So this you have to memorize. There's no cycle involved. Okay. Vitamin A. Yeah.
It can't be vitamin E.
Okay, so you know we have this fat soluble vitamin, Friday we'll talk about it, okay? Vitamin A, vitamin D, vitamin E, vitamin K, 4 vitamins. They are fat soluble vitamins. B and C, they are water soluble. So the function of vitamin A is to give you good vision, night vision. It doesn't affect cones in your eyes. It only affects rods. So it gives you only night vision, dark, gray, and light vision, not color vision. It doesn't help in that. Vitamin D is for strengthening of your bone, because it absorbs calcium from duodenum into blood. Calcium absorption is vitamin D. So it will have calcium problems, hypocalcemia, bone fractures, and things like that. Vitamin K is required for carboxylation of clotting factors. We'll learn that, okay? Meaning it's required for clotting factor formation. So clotting factor is supposed to prevent bleeding. But vitamin K deficiency will lead to bleeding disorders. Vitamin A deficiency will lead to nighttime blindness and skin problems. And then vitamin D will lead to bone problems, fractures and pains, and hypocalcemia. And vitamin E it's not a big deal. There's other things that will compensate for it.
But he has bruising, so he has like some likely bleeding.
On physical examination, you notice a measles-like rash and some bruising. The boy's immunization history is unknown. So they're telling you that the rash is because of measles. Okay, so now with vitamin K, you don't get a bruise. You get large bleeds. Okay, so we have minor bleedings, small bleedings, and large bleedings. Small bleeding is due to platelets and vitamin C. Large bleed is due to clotting factors, and that's vitamin K. So you won't have a bruise. There'll be a wound that will be leaking blood. Huh?
This is one color out. Even if it's under the skin.
Yeah, under the skin it wouldn't be just like an easy bruise. It would be major.
Like
Yeah.
hematoma, it will be hematoma.
Yeah. It wouldn't be measles-like rash. Okay. An 80-year-old female presents to your office complaining of fatigue. How many more to go? She lives alone. Oh, thank you. And her diet is mainly composed of bread and tea. The patient has also painful swelling, hemorrhagic gums. Every time there's gum problems, bleeding, vitamin C. Which of the following subcellular structure is most likely responsible for this patient? So people who are homeless, who don't have good diet, like bread and tea, vitamin C problems. So what would you think? But what does vitamin C do? Yeah.
Collagen.
What does it do to collagen?
Hydroxylation.
Hydroxylation. Is that translation problem? Transcription problem? Post-modification problem? So it's post-translation modification or post-transcription modification?
Post-translation.
There you go. And where does that occur? Golgi and endoplasmic reticulum. Rough ER. Yeah. And both are post-transcription, post-translation modification, but vitamin C does it and rough ER. Okay, so endoplasmic reticulum E is the answer. You were supposed to add this information, make a conclusion on your own. Yeah. Okay.